Today we're going to discuss celebrities. Their image on the screen is everything. We're going to particularly focus on their eyelids and their eyebrow region and how their image has changed over time. So I'm an oculoplastic surgeon. I have over 35 years experience, and I'm going to go through with a fine-tooth comb what is exactly wrong or changed in each one of these celebrities. So let's talk about Adele as an example. In her early photographs, you can see that she has a very heavy looking upper eyelid, and there's a little bit of a lateral hooding going on as well. And she's pretty young at that stage. That's a congenital appearance that is not really age related, because she's only in her teens at that point. And there's no evidence of her upper lid creases, really. Her crease is hidden by the heaviness of her upper lid, and her eyebrow position is kind of straight across. As we see later photographs, however, we see a much different appearance, and her appearance has now changed, and she has a very defined arch to her brow. Most likely, although it's not definite, she's probably had a brow lift, probably what's called an endoscopic brow lift, which is a incision behind the hairline to raise the brow. And then she most likely had an upper eyelid blepharoplasty, which is the medical term for upper eyelid lift, or where a piece of skin and possibly underlying muscle and inner corner fat have been removed. Now, in her case, she has a very symmetric looking upper eyelid and eyelid creases, so whoever did it was technically very meticulous in their approach. However, it looks like to me that there's been a little bit too much fat or muscle removed from the inner corners of her upper lids, which look great right now. But as she ages, what's going to happen is she's going to have a hollowing effect that occurs up here, and it's going to give her a very aged look. So we have to see how these procedures age forward. Sometimes you have to think about procedures that are done today may not age well over time. Another celebrity that I'd like to discuss is Cher. She's someone we all love, and when we go back and look at her early photographs during her early career, you can see that she has a low crease, and unlikely she had surgery at that point. And you can see that the crease is about 1/4 to 1/3 of the height of the vertical height of the eyelid, and there's preservation of tissue above the crease. As she aged, she underwent presumed surgery on her upper eyelid. She had a blepharoplasty and most likely a brow lift. Her brow arch now looks too high. It looks like she has almost a surprised look. And by splitting that dimension between her upper subbrow skin and lower eyelid skin, she split the dimension of her upper eyelid in half, and it gives her what I call a doll's eye appearance. It looks unnatural. How they achieve that is the surgeon most likely made an incision a little too high, and also probably extracted too much skin, muscle, and underlying fat, to creating a hollowing of the upper sulcus, which is up here. And again, this doesn't make her look younger. It actually gives her a slightly older look because it looks unnatural. So let's talk about a younger actress named Erin Moriarty. And if we analyze her upper eyelid anatomy following a blepharoplasty, we can see that this surgeon also decided to make a upper eyelid skeletonized appearance to her upper lid, which split the dimensions of her upper lid, again in a 50-50 fashion, and created this hollowing due to removal of skin, muscle, and fat. So these techniques, unfortunately, are techniques that were used 20 or 30 years ago, and many plastic surgeons still are wed to the techniques that they learned during their residency or fellowships, and they haven't really evolved, because currently the feeling is that we should try to preserve as much of the natural tissue as possible, and that is just to kind of trim the upper eyelid skin, preserve the underlying muscle, trim a minimum amount of upper inner corner fat, and do a very nice closure, so that in the end you get a very natural crease, and the dimensions of your upper lid look like they haven't been operated on. When the surgeon resorts back to their teachings that they learned earlier on, they end up with a unnatural, unfavorable appearance. And in this young actress, as she ages, this is going to look worse with time, not better. Okay, I want to point out one more celebrity, Sylvester Stallone. And Sylvester Stallone has a certain look that we're all familiar with, but as we look back in time, we can see that actually Sylvester Stallone has an underlying medical problem, or let's say he was born that way, in which he has probably eyelid ptosis, which is like a drooped upper eyelid. So he looks kind of sleepy and looks like he was in the ring, but he actually has ptosis, which is this droop due to a muscle weakness on the upper lids, and it may be congenital. And actually his lower eyelids are also a little saggy down here as well, and that may or may not have been a surgically induced problem, but it looks like he was born that way. So how do we know he has ptosis? Okay, when we look at his face, we see that he uses his brow, and he has deep furrows of his upper brow, especially in his older pictures. And as he ages, it gets worse, because he has to really crank up his brow to raise his eyelid up above his visual axis. So what he really needs is not necessarily a blepharoplasty, but he needs is what's called ptosis repair. And that's tightening the muscle internally in the eyelid to raise the eyelid up. It has nothing to do with the skin and brow position necessarily. So he's kind of an interesting case to look at. In terms of his lower eyelid, the hammock is hanging low, and you can see the whites of his eyes actually, even in early photographs. So again, this may be a congenital problem that's persisted over time. It can easily be fixed by just tightening the corner of the eye upward and securing it to the rim over here. So we get this tightening of the hammock, and it prevents tearing and exposure of the eye as well. So when I was in training in Beverly Hills in the 1980s, we saw celebrities all the time come in with eyelid problems. That was the main focus of our practice there. So it's not always dependent upon how much money you have or how much notoriety you have in terms of getting what I call good surgical outcomes. You really have to go to someone who knows how to analyze your problem in detail and really dig deep into exactly what's going on, and then you'll end up with a better result. So I hope you've enjoyed this reactionary video. I am going to continue to produce these reactions to celebrities who've undergone cosmetic surgery, so that you can see what's good and bad, and hopefully that'll give you more information for your own issues and problems when you go to your own surgeons. And if you enjoy this video, please subscribe to my videos, and I look forward to seeing you again in my next video.